I think health equity is critical, especially in oncology. Health equity really means that health can be achieved, full potential for health and well-being across populations, regardless of how they're defined socially, economically, demographically. And social determinants of health is a little bit different. It's just these are the domains in which you can end up with inequities, where whether it's economic stability, educational status, healthcare access, neighborhoods, social and community context, these social determinants of health are the characteristics of each individual that define sort of how they're going to interact with the world. And in healthcare, it's important to unpack and understand the social determinants of health of your population. When we don't, and we have systems in place that provide systemic inequities, we end up with health disparities. We end up with survival rates from cancer that are lower in people of color than others. And so health disparities end up emerging from these systemic inequities, systemic issues with hospitals, educational systems, and other institutions. Social justice really can define a lot of things, but in essence, it's the ability of equitable distribution of healthcare, equitable distribution of wealth, justice, education, such that all populations have a shot at attaining their full potential for health and wealth and success in life. Systemic issues relate to how our institutions have been put together to potentially benefit one population over another. And it's not really based on individual biases or individual decisions of people within the institution. It's just the overall institution may benefit one population over another. Things like where a hospital is located and whether patients have access to transportation to get there, whether they have access to child care, whether they're able to pursue treatment. And that's sort of a systemic issue, is things like geographic location of healthcare. Issues like implicit bias are more on an individual basis, where providers, clinicians, physicians may make slightly different decisions on how they're going to manage patients based on the color of their skin, based on interactions that they may not be aware of. So through things like racial equity training, you can begin to look at health equity through a new lens and begin to understand implicit bias and potentially prevent individuals from making decisions based on things like skin color. Unfortunately, a lot of our patients do feel like they don't connect as well with their physicians, and they do not have as good of experience. We do find that there are populations who feel like their pain management is not handled as well. And when there are disparities in time to surgery, time to radiation, time to chemotherapy, those delays lead to different survivals. They lead to worse survivals. Some of the important components of the work that we've done here are related to transparency and accountability. The transparency is seeing the data and parsing the data by gender, by race, so that you can look at the outcomes of your patients by gender, by race, and see whether there are disparities. That's the transparency. And the accountability is to ensure that you're addressing those disparities, that if patients of a certain color are not getting their mammograms at the rate of other patients, how are you addressing that? How are you holding your clinicians and your community advocates accountable? So I think, unless you turn on the light, you can't really see the level of health inequities that we currently have. And you turn on the light by looking at the data, by creating dashboards, by having hospital leadership and clinicians aware of what's happening in their own health system.